Welcome to Have More Babies. Today, we're diving into something really important, especially if you have little ones or are maybe thinking about starting a family.
Yeah, we're talking about pertussis. You probably know it as whooping cough.
Exactly. And specifically, why getting vaccinated against it is so critical.
hmm Our info today comes from Omega Pediatrics. They're a pediatric care provider down in Roswell, Georgia.
Right. And they've laid out some essential facts about pertussis, which can be, well, pretty serious.
So definitely. We want to cut through any noise and just give you the straight scoop.
So if you're looking after young kids or planning to, this is definitely for you. Stick around.
Okay, so first things first. What is pertussis exactly?
Well, according to Omega Pediatrics, it's a serious infection caused by bacteria. Bordetella pertussis, I think?
That's the one. It's a specific bug that goes after our airways.
Uh-huh.
Omega Pediatrics uses a neat analogy.
Oh, yeah.
They say, just like we have apps for almost everything now, there's a vaccine for this too.
That's a good way to put it.
And they really stress that deciding not to vaccinate, well, that choice comes with some real risks for your child.
Absolutely. It's not just like a little cough we're discussing here.
No way.
Omega Pediatrics points out it's highly contagious.
Super contagious. Spreads through coughing, sneezing, basically airborne droplets.
Things that happen all the time, especially with kids, right? Hard to avoid.
Exactly. And what's really key here is who gets hit hardest.
Okay. Who's most at risk?
The source is clear. Children under 6 years old. They're the most vulnerable group.
Under 6.
And the stats, well, they really make you stop and think. About 6% of kids in that under 6 group, they'll have complications.
6%. Okay, that's not insignificant.
But wait, it jumps way up for the really little ones.
Ooh.
For babies under 12 months, it's almost 25%.
Wow, 1 in 4.
Yeah.
Yeah.
And then for infants under 6 months, it could be as high as 37%, nearly 2/5.
37%. That's quite alarming. Those are serious numbers.
They really are. It highlights the danger for the youngest babies.
So what should parents be looking for? What are the initial signs? Does it start off bad?
Actually, no. That's the tricky part. Initially, it can look just like a common cold. Mild cough, maybe a runny nose.
Okay, so easy to dismiss at first.
Very easy. But then, usually around the 2-week mark, it shifts. It goes into what they call the paroxysmal phase.
Ah, right. This is where the whooping part comes in, the classic symptoms.
Exactly. You start seeing these intense coughing fits, like multiple short, rapid coughs all in a row,
Mm-hmm.
followed by that sudden, forceful gasp for air trying to breathe back in. That's the characteristic whoop sound.
Right, the sound everyone associates with it.
Yeah. Though it's important to know, the whoop isn't always there,
Mm-hmm.
so you can't rely on hearing it.
Good point. What else happens in this phase?
Vomiting after a coughing spell is also really common. It's just that intense.
Oh, poor things. That sounds absolutely miserable. How long does this phase last?
It can drag on for quite a while, anywhere from 2 up to 8 weeks.
2 to 8 weeks, that's rough.
It really is. Incredibly tough on the child and, on your parents watching them go through it.
I can only imagine. And what comes after that? Does it just stop?
Well, then comes the convalescent stage. Things do gradually start getting better.
Okay, that's good.
But the cough, it can linger, sometimes for another month or even longer.
Still coughing for weeks, even after the worst is over.
Yeah. So even recovery is a long process, which again really drives home why preventing it in the first place is just so vital.
Absolutely. Let's talk about those complications you mentioned. The source material really emphasizes how serious they can be,
It does. And it starts with the most severe potential outcome,
which is...
sadly, death. Omega Pediatrics is very direct about this.
And who's most at risk for that terrible outcome?
It's highest for infants under 6 months old. These are the babies who haven't finished their primary vaccine series yet.
So they're basically unprotected.
Exactly. And tragically, they often catch it from older kids, siblings, maybe other relatives who might be unvaccinated.
That's heartbreaking. The thought that an older, maybe seemingly healthy kid who isn't vaccinated could pass it to a tiny baby.
It's devastating. The source makes that exact point, how an older child's lack of vaccination could lead to an infant's death.
Wow. The source also mentions something about zessides.
It does. It notes there's ongoing research looking into a possible link between SI days, sudden infant death syndrome, and maybe undiagnosed pertussis cases.
Okay.
But, and this is crucial, they also state clearly that a definite link hasn't been proven yet. So it's an area of research, not a confirmed connection.
Got it. That's important context. Beyond the absolute worst case scenario, what other serious issues can pertussis cause?
Pneumonia is listed as the most common complication.
Okay, lung infection.
Right. The Bordetella bacteria infect the lungs directly, causes inflammation, fluid buildup, makes it really hard to breathe.
And the source describes some grim findings in babies who died from this.
Yes, it does. It talks about severe findings like pulmonary hypertension, high pressure in the lungs arteries,
Yeah.
necrotizing bronchitis,
Which means,
damage to the airways, basically tissue death because of poor blood supply, and even microbleeds, tiny hemorrhages in the lungs,
oh my goodness.
leading to a situation where infants can essentially, horrifyingly, drown in their own fluids.
That's just terrifying to even think about.
It is. And the source keeps coming back to the same point.
Yeah.
This is preventable with vaccines.
A powerful reminder. Are there other major complications?
Yes, apnea is another big one. That's when breathing just stops.
Stops completely.
Temporarily, yes.
Yep.
It happens almost exclusively in babies under 6 months, sometimes a bit older.
What triggers that?
It can happen right after those violent coughing fits or sometimes just spontaneously, possibly due to nerve stimulation from the coughing.
Wow. Are there numbers on how often that happens?
Yeah, the source cites a study from a pertussis outbreak. It found apnea in 26% over a quarter of infants under 6 months
26%.
and 14% in babies 6 to 12 months old, and still 8% in kids aged 1 to 5 years.
Those are significant numbers, especially for the youngest.
Definitely. And it doesn't stop there. There's also the risk of convulsions or seizures.
Seizures related to the pertussis.
Yes, new seizures caused by the illness. Studies suggest this occurs in about 1 to 2% of children who get pertussis.
1 to 2% might sound small, but for something like seizures.
It's still very concerning. And there's mention of a Danish study suggesting maybe a slightly higher risk of developing epilepsy later on in life for kids who've had pertussis.
Interesting. And brain issues.
Yes, encephalopathy, which is basically brain dysfunction. Thankfully, this is rarer, less than 1% of cases.
But still possible.
Still possible. And the source suggests it might be linked to an abnormal immune system reaction to the infection. The real worry here is that it can lead to chronic, severe, lifelong health problems.
Which is especially tragic for a child with their whole life ahead of them.
Exactly.
Okay, so summing up all these potential dangers, death, pneumonia, apnea, seizures, brain dysfunction, it makes the message about vaccination incredibly clear.
Absolutely unavoidable. And Omega Pediatrics puts it bluntly. Do not skip your child's immunization, period.
Right, no ambiguity there.
None. And they strongly warned against trying, creative schedules or delaying vaccines based on misinformation. They call those ideas conjectures from charlatans.
Strong words.
They are. They even quote Dr. David Kimberlin, who's a big name in pediatric infectious diseases editor of the Red Book.
Okay, what did he say?
He presented data showing that the actual number of immunological components, antigens in vaccines today, is tiny compared to even, say, 1980. We're giving kids far fewer antigens now than we used to.
That's a really important counterpoint to some of the fears people might hear.
Definitely. The science supports the safety and importance of the standard schedule. The information urges everyone to follow the recommended U.S. immunization schedules.
Which parents can easily find from their pediatrician or the CDC.
Exactly.
Now, let's circle back to our source, Omega Pediatrics. How does their practice tie into this whole discussion?
Well, the information they provide highlights that they really get the challenges parents face.
Yeah.
Kids getting sick after hours.
Mm.
It happens all the time.
Oh, tell me about it. 5:01 p.m. on a Friday.
Right. So they emphasize their extended hours. They're actually open until 9 p.m. on weekdays for walk-ins.
9 p.m. That's really helpful.
Yeah, and they also offer telemedicine visits for their existing patients. It's about making care more accessible.
And that includes vaccinations.
Yes. Importantly, they specifically mention offering immunizations and other preventive care, like checkups, during those extended hours, too. It's part of their commitment to convenience.
That really does sound like a practical resource for busy families trying to stay on top of things like vaccine schedules.
It seems so. And if you want more detailed info or you're looking into pediatric care options,
Where should people go?
they should visit omegapediatrics.com.
Let's say that again clearly.
omegapediatrics.com. You can find out more about their services, their hours, and how they approach keeping kids healthy, including, of course, vaccinations.
Great. So, wrapping this up, the main takeaway seems crystal clear.
Yeah, pertussis is serious. It's contagious. And the complications, especially for babies, can be life-threatening.
But it's preventable.
It absolutely is. Vaccination is the key. It's our best defense.
We really hope you, our listeners, take this information to heart. Think about what it means for your family, your kids, your community.
Definitely food for thought.
And maybe a final question to ponder. When you weigh everything we've talked about, the severity of the illness, the complications, what factors really become the most important when you're making decisions about vaccination for your child?
That's the crucial question, isn't it?
If you found this discussion valuable today, please do give this video a like.
Yep, hit that thumbs up.
And subscribe to our channel. That way you won't miss out on future deep dives into important topics like this one.
And share it. If you know other parents, expecting parents, anyone who looks after kids, pass this along.
Absolutely. Thank you so much for joining us today on Have More Babies. We really hope this has been informative and helpful.
Thanks, everyone. Stay safe and healthy out there. Goodbye.